Hello, my name is Troy McCormack, and today my presentation will be on the electrocardiogram and the correlation of it to cardiac events. So this is an echocardiogram, or EKG, that shows um, a patient's heart beat over a certain amount of time. So here it kind of scratches out. We'll look at this one here, and you can see it kind of shows the heartbeat going on. And we'll be getting into exactly what these little ups and downs on the graph paper are, and how to find out if it actually means something. This echocardiogram shows a heart attack, so we'll try to find out how to distinguish that from a person who's not having a heart attack. So what can an EKG determine? Well, an EKG can determine a muscle defect, an enlargement of the heart, um, congenital defects, heart valve diseases, arrhythmias, which are abnormal heart rhythms, tachycardia or brachycardia, the heart rate being too fast or too slow. Tachycardia is too fast, brachycardia is too slow. Ectopic heartbeat, coronary artery disease, one of the leading causes of heart disease. Inflammation of the heart, which is myocarditis. Inflammation around the heart, pericarditis. Changes in the amount of electrolytes, so it can check some of the physiology that can be determined by that. And myocardial infarction, which is known as a heart attack. And it can see if it's been past or present. That's why it's very important, if you feel that there's anything wrong with your heart, to go to the doctor and get checked out. Not just the doctor, but maybe even the hospital. So how does an EKG determine a cardiac event? Well, first things we have to find out is, what to expect during an EKG. So, um, there's going to be these electrodes that are attached to the body, and these electrodes transmit activity to the EKG machine, which is this thing here. And the EKG machine creates a pattern which represents the heart's rhythm. So it's going to give all those little things that we were going over before. So this is kind of the process on how the EKG goes over, how it connects up to the body and allows you to see what's going on with the heart. So what those leads do is they're going to determine what's going on here. We're going to be looking at the different um, recording information, or the waveforms on an EKG, by hooking up those electrodes. And they're going to show, the electrodes are going to show the beginning of the heartbeat, which is the P, the beginning of this QRS portion, which is also very important, and then the reset of the heart right here, the T. And so this is one whole heartbeat, and it takes place over time, which is a measurement here on this graph paper. And it's also called an ECG, ectocardiogram or echocardiogram. Those are interchangeable terms for the same process. And we're going to be getting into what the P does and what the QRS does, and how this T, how they all come into play. And there's going to be things about the distances between, the P and the Q, and how they all, can show us different abnormalities that are happening within the heart. So here's a good graphic that explains kind of what's going on in the wave function here. So we have the PQRS T portion of the EKG, and so the P correlates directly with the portion of the heart, which is the SA node right here, and it takes place in the atrium here. And what it does is it gives a signal. It says, okay, heart, I'm going to give you this electrical signal. It comes from the brain, and it says, all right, let's go ahead and make this thing happen. So it gives off an electrical signal, which goes through the funny channels, and it goes in here to the ventricle, and the ventricles are given their signal from the AV node here to contract, and then the T wave happens here, and it is the recovery of it. So it goes ahead and it all comes back, all that repolarization that occurs within those channels, and it's ready for another heartbeat now. So here we have a little diagram of the heart and the blood vessels that supply the heart. These are called the coronary arteries, and they're the ones that give the cardiac muscles the blood supply to continue to beat. So, blood would kind of flow in through these portions here and give the corresponding muscle cells all their nutrition that they would need. And so if one of these, say, gets cut off, say with some plaque, let's say a little bit of plaque gets built up right here in the heart, and over time it stops, and then a blood clot would form, and then a blood clot would form, and then it would stop the heart muscle from getting the nutrition that it would need, or the blood supply, so the oxygen and the sugar molecules that it needs to contract. Well, it's going to stop that portion of the heart, and that can be seen on the EKG. So here we have a normal heartbeat. It's going good. Everything looks good. You can see there's a good distance between the P and the Q here, and then everything looks good here from the S to the T. Everything looks good. Well, you can see here there's an acute injury that occurred on this EKG, and right here they call it the J point. It's right where the S is, and it doesn't really go down all the way. So it doesn't create that all the way down to that S, which means there's probably a problem with the portion of the heart which is corresponding to that location, which is the ventricles. And there's an acute injury. So likely, what this is what's going on. Some sort of thing. Maybe it's here, maybe it's here, and that's what's causing that little heart attack there. And if there's something like this V wave here, or this T wave, something's going on there, that means there's ischemia, which means that's able to tell, okay, oh, wait a second, it's not able to, the heart's not able to reset itself. There's something going on there. There's a problem. It didn't come all the way back down here, and then there's a big V. That's a heart attack. Uh-oh, something's going on. And then another thing too is right here, if the V wave is before the QRS, it shows, oh no, there's necrosis, and that's bad. That means that the heart has been damaged. So all these things can be seen, and with the heart, with the EKG, everything can be. This is how we can tell what's going on with the heart. Currently, there's not a 3D model that we can check out yet that can look at it perfectly and see what's going on. So depending on where those leads are at, a heart attack can look like either an elevated portion here or a depression here. And this term is called a myocardial infarction, and it is pretty much just decreased blood flow to the heart. And that's what's going on during that, either decreased blood flow or a problem with the nerves. And that's important. The EKG can help determine that as well. So up here you can see here's a normal PQRS, and this is our key to what's going on here. So earlier I mentioned that there might be something wrong with the nerves of a heart. Well, this situation is called a heart block or heart blocks if there's multiple ones happening at once, but if that happens, most likely the patient would be dead. So going over some normal heart blocks here, there's this one here coming from the SA node called the natural pacemaker, and this one happens when the P waves are the same. So all these P waves, what that means is the distance between the P and the Q are the same. And what you can tell, and by the same I mean it's the same distance over time. It's one block long on this EKG. But then there's these things that can happen within the AV nodes, which is the node directly down from the SA node. What happens there is you could have a Winky-Bach, Mobitz 1, So this would occur in the QRS series here, and there would be an increasing distance between the P and the Q. So the distance between the P and the Q would increase, and that would be a Wenckebach or a Mobitz 1. And then there's also a Mobitz 2 type of block. And there are several different types of blocks. I'm not able to go into all of them right now, but these are just a couple. Mobitz 2 it's in the QRS series as well, and it would look a little bit different. And that one would require a pacemaker. And what happens with that is there's just no QRS in that one. So this QRS, it wouldn't be there. It would just be gone. So these are things called heart blocks, and they're very, very damaging to the heart. But there are ways to fix them, which is some good news for this. So getting into a little bit more of the cutting edge science on the matter. This really isn't cutting edge. This was done in 2015, but they found that these heart monitors during birth are helpful for determining whether or not a C-section is going to be needed for an emergency C-section with a baby. But what they do is they take the monitor and they'll put it on the top of the baby's scalp when it's popping out of the cervix, and that will help determine more. You can get an EKG during birth, and because that's a very stressful time for the mother and the baby, and any type of information that can be gathered, especially during that that time when that baby's popping out of that canal, can be very helpful. And it lets them know pretty much when to perform an emergency C-section, but it doesn't really help with anything more than that at the time. Right now, maybe in the future it can, but currently this is really good for helping in emergency C-sections. So another interesting concept is the EKG abnormalities that are occurring in children that have temporal lobe epilepsy. So temporal lobe epilepsy is a condition in the brain where it causes seizures. Well, there's also these EKG abnormalities that can occur in them, and because these temporal lobe epilepsies can result in death, so it affects the heart. And what this study has found is that changes in the cardiac rate and rhythm are found in adult patients with temporal lobe epilepsy and could be involved in the pathogenesis of sudden unexplained death. However, little is known about the heart rate variability. So what this study did was it looked at pediatric patients, and it found that the cardiac dysregulation, cardiovascular dysregulation, so the management of that, the graph, the EKG, all the different things that are happening in the heart, it's common in children that have that. And so, the right hemisphere is affecting the heart. So, kind of studying that aspect can help produce results in children who are suffering from this. We'll try to figure out ways to maybe go right to the base of the problem, which would be the right hemisphere, and fix that some way with either drugs or surgery or whatever it would take in order to not have a problem in the heart, because the lungs and the heart are pretty much the most important aspect of staying alive. And if those two things are out, mainly the heart in this case, bad things can happen. So with that, I thank you so much for watching my video. I appreciate all these different people here who have contributed to this by allowing me to see their stuff on the internet. And so I've given them references. And I appreciate your time, and I hope you have a great day. Thank you.